Good afternoon, and thank you for joining me for another Leadership Rounds. I'm Dr. Mindy Estes, President and CEO of the St. Luke's Health System in Kansas City and Chair of the American Hospital Association Board. This week, I'm pleased to introduce Dr. David Perlstein, President and Chief Executive Officer of SBH Health System, formerly St. Barnabas Hospital, located in the Bronx, New York. SBH Health System includes a teaching hospital, an ambulatory care center, and a behavioral health facility, in addition to many health services that serve a vibrant and multicultural community. In addition to his executive leadership role, Dr. Perlstein continues to be clinically active, having spent the majority of his career promoting better health and health care. He has written and lectured nationally on the topic of social determinants of health, and he's past chair of the AHA's Committee for Clinical Leadership. David, thanks so much for joining me today.
My pleasure, Mindy.
During the earliest days of the COVID crisis, as the rest of the country watched the dreadful news coming out of New York, what key actions did you and your team take to help your staff deal with the demands and the intensity of the work?
Sure. Thank you. Thank you for the question. And I'm sure it was just a wonderful intro. I'll tell you, COVID hit us hard and fast. In some ways, probably harder and faster than any of us could actually manage. And it became pretty clear pretty quickly that our staff were going to be working very, very hard, and we would not be able to step in and work for them. I mean, as a physician, I'm a pediatrician by training. I would have loved to have stepped in and managed ventilators on adult patients, but that simply wasn't going to be a responsible thing to do. Therefore, we recognized that we had to find ways to support them to the best of our ability, making sure that they had tools, making sure that they had the right PPE and they were following all the recommendations. So the simple things like that had to be done. And then very quickly, as we really became overwhelmed as an organization, because we knew the job that had to get done, but we had almost quadrupled the number of intubated patients that we generally take care of. We had turned general floors into ICUs, and we started seeing patients who were very ill and patients who were expiring. And it was an incredibly overwhelming experience for all of us, including our staff. And so we tried to come up with ways that would make their lives easier. We looked for things that would allow them to focus on work, and when work was done, they could actually focus on themselves and their families. So we started covering all the costs of food. We started sending them home with food packages or care packages. We covered the cost of their transportation because at that point the subways stopped working. And then we also took care of their mental health issues because we realized they needed a quiet space just to stop working. And so we transformed a number of units just into quiet zones. Everyone was socially distanced, of course. But we had quiet zones. We developed mental health support. So we had a 24-hour line that we ran. We did frequent rounding. And then on top of that, we realized that we had to supply and support and inform. So the information we continued to run all during the height of the pandemic, which meant we were doing daily updates, both by conference calls, but also through our web-based blogs. My CMO and my COO were putting out daily informational blogs, and I was writing a heroes blog twice a week, which really spent time recognizing folks that were doing phenomenal jobs and thanking people. Again, there was as a physician, you understand that we learned that we want to get our hands dirty and get into the operations side. But as you also know, that when you take on roles in leadership, that may not be the best choice. And I found myself staying pretty much clear of the floors because that meant I had to use up PPE that otherwise would have gone to my staff. And that was probably a very difficult thing for us. But we found this new way to communicate through the web and through conference calls and through live services.
So as a physician, from a clinical perspective, looking back where you stand today, what do you think the biggest change you've seen that are helping treat and manage the virus? There have been a number of changes.
Yeah. So look, again, bringing back the fact that we're both physicians and we're both used to being able to practice highly reliable medicine. COVID did not allow for that. Um, uh, we were seeing a lot of contradictory recommendations coming out. We were seeing med shortages and supply shortages, and often we had to make do with what we had. It seemed more of a triage and wartime experience than I've ever experienced, but from colleagues of mine who have in fact been in those settings, they said it was probably the closest to that they've ever been. Um, and I would say during the early days of the pandemic, it was challenging to identify what we should do for patients to keep them alive for the most part and well. Uh, and over a period of time, things started to get a little clearer. So medication treatments started to come out that were used. We started to see more papers being published, so there was more evidence that was supporting doing A over B. And we started really focusing in on those more effective treatment guidelines. Some involved several medications and certain type of ventilatory support. And on top of that, we spent a lot of time talking to our colleagues. So there was a lot of interinstitutional collaboration that was occurring at that point to find out what was working for them. And today, I don't want to repeat what New York had to go through, and especially the Bronx had to go through back in March, April, and May. But my sense is if it were to recur here, we would not see the same level of acuity as we saw last time, because I think there is more of an understanding of just the entire disease process, and there is more availability still of appropriate medications and services.
Yeah, it's amazing to me how much we've learned in a short period of time. Here in Kansas City, we have actually more patients in our health system today with COVID than we did in the April timeframe. But how we're caring for those patients and keeping them out of the ICUs, I think we've learned over the last 3 months. Now, you serve a multicultural community in the Bronx. What advice do you have for other hospitals and health systems in tackling the racial and ethnic disparities that have always been present in healthcare, but have become so evident with COVID-19?
Yeah, so that's a big question, and I will tell you, our community, which is in the Bronx, is a challenged and challenging community, and a large part of that is that SBH has a long time recognized that they play a larger role than just healthcare provider. We know that the community we serve has long been victimized by structurally racist policies, by policies that have impacted people's sense of food security and housing security and educational security, and the disparities are there. What's important for us to know is that we can't be just seen as a visitor. The hospital is an anchor institution. We employ a lot of people, and most of those people actually live in the Bronx. And we've never really viewed ourselves as being a guest. And therefore, we have to spend a lot of time listening and learning from what our community needs instead of assuming that we know the best thing to do, which is what hospitals tend to do. An example of that is, and I'm sure you're aware of it, we're just finishing a housing development that we donated some land to a developer who is, believe it or not, a mission-driven developer, and we helped build 314 units of affordable housing, because our sense is I can address housing insecurity by making sure that people have safe, affordable places to live, and I would argue that is out of my wheelhouse, which is why I didn't build it myself. But it also aligns with our mission, which is not to displace our community, because obviously I would have made a lot more money if I built a condo. But that really isn't what I'm in the business for. I'm in the business to ensure that my patients have an equal opportunity to live happy and safer and more productive lives. And a large part of that really is to recognize that the Bronx for the last several years, many years, has been ranking the bottom of the counties in the Robert Wood Johnson's county neighborhood county wellness survey. There are 62 counties in New York, and we're number 62, which is nothing to be proud of. And it's in large part due to the long-term policies that have been there in the Bronx and in other areas where we have high numbers of people of color and a lot of poverty. So we recognize that it's got to be a balancing act between not being too paternalistic and identifying answers, but actually knowing when to push and when to pull in order to get the outcome you're looking for. It is not an easy solution, but we do know that people of color, especially in high poverty areas, more people died and more people were admitted and got sicker with COVID than in other communities. And that really is a reflection of the fact that these issues have been out there for a while, and COVID simply pulled back that thin veil to show everybody else that those issues are there. My hope is that we will really, as a country, start focusing on those issues that we know are there and start putting in policies and investments into addressing them. I'm not convinced yet, but I'm hopeful.
I'm hopeful as well. It certainly has been a wake-up call, and now it is up to all of us to act upon it.
Yes.
As the pandemic reaches into the fall season and beyond, the role of hospitals and health systems as trusted sources of information will become even more critical. What messages do you feel need to get through to your local community to continue to enlist them as an active part of the solution? Because we are a long ways from being done.
I think the number one message, first of all, is that hospitals are safe environments. I think a lot of our patients really started to see hospitals as death dealers. It's basically a pandemic outbreak, and you want to stay away from there, or you're going to get sick. And the fact is that the data doesn't bear that out. In our institutions and our hospitals, our hospital-acquired rate was next to zero now, and it was very low at the time, even of the height, because everyone was socially distancing and wearing masks. And now we have put in policies to test and to screen and to do those things to even keep those numbers even lower. The problem is we still have to be able to convince folks. And you also, though, have to recognize that you're not going to convince everybody. So that you're going to have to find a way to get to your community and take care of your community in those non-traditional manners. I would argue outside of a place like the Bronx, where technology has not been the easiest venue. We are offering our patients opportunities to still do telephonic or video visits if that's what they want, though a lot of our patients do want to come back in. So we're working, as we always have, with our local community boards. We're working with community-based organizations and with some of the religious organizations and the leaders to make sure that we're giving them what they want. Again, it's a conversation something that I mentioned to you before, is the idea of the pushing and the pulling. If they need something from us, we can't just assume we know what that is. So you have to be able to go and ask, what do you need? Recently, we had an organization come to us and said, can you help us with a voter registration? Okay, we'll be a good partner in that. And we handed out masks during that process to make sure they had them. We are on all the news channels talking about the importance of social distancing and wearing masks. I mean, it's been proven over and over again that wearing a mask definitely helps. It definitely prevents the spread of the disease. So I think it's not going to be the simplest to convince everybody to come back, but I don't know if everybody needs to come back. I just think that they need to continue to get the care that they deserve and desire in order to stay healthy, and they need to have the right information to not get COVID.
Well, we need to follow the science and be sure those simple messages as masking and social distancing get out there.
Yeah.
David, it's always a pleasure to talk with you. Thanks for joining me today. I know you're exceptionally busy. We appreciate your insights. And I hope everyone will join us again on August the 13th for our next Leadership Round conversation. Thank you.
Mindy.
Be safe. Stay well.
You too. I hope to see you soon.
Me too.
Bye-bye.
Bye-bye.